Eastern Oregon. Thank you for joining us tonight, and it's a pleasure to be hosting this forum, this town hall tonight on EO Live TV, and it's being shared in a number of locations, and also on Blue Mountain Translator District. And so before we get started, I just want to kind of introduce to you the gang that's with us tonight. Grand Ronde Hospital, Jeremy Davis, the CEO, is here with us, and this event really is being put on by the Grand Ronde Hospital. I'm just facilitating this for them, and we're really glad that they chose EO Live TV to have this place, have it here. Grand Ronde Hospital's Dr. Hunsaker is going to be here. He's going to talk to us about, he's in charge of the actual COVID treatment at Grand Ronde Hospital, be talking to us about the specifics of that. Carrie Brigiotti, Carrie, you and I spend quite a bit of time talking in this exact format, and really appreciate you being here. Carrie is from the CHD here locally. And then George Mendoza from La Grande School District. George, thank you so much for taking the time to be here. Really appreciate you guys being here with us tonight. So first, let me give you a few ground rules. This is kind of a, let me get my notes. This is an active thing. We want you guys to, the audience, we want you to be a part of it. We want you to submit some questions and so on and so forth. And there is an email address and so on and so forth, that where you can submit your questions, or you can put them into the Facebook comments on any of the places where it is streaming on Facebook, and those comments are being monitored. Those questions, as we have an opportunity, will be forwarded to the people that are most qualified to answer those questions. I would remind you to be respectful in your comments and your questions and what you ask. Everybody here is a dedicated professional. They are committed to helping us get through this crisis, and it's important to me that we treat them that way. But at the same time, we really want to hear from you. We want to answer the questions that maybe have not been answered. Now, there's a lot of questions that we have answered over and over again. Please resist asking the questions that you already know the answers to. But at the same time, we do want to maybe uncover some of the things that you haven't got the answers to in the past. So submit those questions to us. There are people that are monitoring the Facebook posts and the email, and we will get them funneled into the thing. So, all right. Well, the first person that's here with me and is going to be Jeremy. And Jeremy, I sure appreciate you taking the time. Man, what a crazy season this has been.
It has. Thank you, Brent, for hosting this, and we're grateful for the opportunity to share this with others and provide this update to the community. First off, though, I do want to thank Dr. Hunsaker for joining us, as well as Carrie with CHD and George with the La Grande School District for joining this town hall. We spent a lot of time on the phone this year with each other, and your support has been very much appreciated. I'm reminded of the Beatles song, "I Get By with Little Help from My Friends," and we certainly have relied on each other quite a bit this year, and it's been very much appreciated. So first off, I think I would be remiss if I didn't take the opportunity to thank Union County for the support of our providers and our staff and our nurses here at Grand Ronde Hospital. As we all know, it's been a very challenging year, and certainly the messages and thoughtful gestures that we have received have certainly uplifted our spirits and have really strengthened our resolve to continue fighting and to continue to doing our part to provide the best care right here at home. You know, from the beginning, a lot of the decisions that were made both at a national level as well as a state and local level were done with the spirit of protecting hospital capacity. If you recall, very early on, it seems like a decade ago, but back in January and February of this year, the modeling that we were seeing show that the hospitalizations were probably going to outpace the number of available beds. Luckily, that hasn't come to fruition, but still, we're not out of the woods. So on behalf of our providers and our staff, the efforts of Union County residents to physically distance, to wear masks, hand hygiene, and the sacrifices that you have made have undoubtedly helped preserve hospital capacity here at Grand Island Hospital. And to you, we say thank you. One of the questions, that I get, and I hope that through this town hall that we'll be able to provide some updates and even maybe a little ray of hope for 2021. But one of the questions that we get a lot is the patient census and hospital capacity. And I think it's important for the community to realize and to know that this time of year, we typically do see our census rise. And so it's not uncommon for us to experience that. We are certainly comfortable, confident, prepared, and have experience with handling, an increase in patients in our hospital. And we also work with other hospitals throughout the region to monitor bed capacity throughout the region so that we can do our best to keep patients local. But certainly recent news has put hospital capacity in the forefront. And so I thought I would share a little bit of where we stand. So first, I think it's important for folks to know that year to date, we have had over 40 patients who have been admitted at Grand Island Hospital with COVID. And for me, that number, I think, is significant in the fact that it could have been much higher. We've been, again, very fortunate that the hospitalization rate here in Union County is fairly low. And certainly the efforts of community and the support of the community around physical distancing, face masks, and so forth has certainly helped. I'm proud to say that we have not been overrun. We've been able to manage the patients that we normally see on a day in and day out basis. But at the same time, we've been able to take care of patients who have COVID as well. Now, on occasion, we have had to fly some patients out because of their acuity and other comorbidities that they might have had where they needed a higher level of care. But by and large, we've been very fortunate in that we've got a great team of doctors and nurses and support staff that have trained and prepared and have really stepped up, often working extra hours, extra shifts to make sure that we're taking care of our local community, which is an honor and a privilege.
So
now, certainly,
let me ask you a question real quick, Jeremy. So give us some kind of a frame of because we just don't know. I mean, so if you had to give, at it, I don't know, and you can frame this however you want, and it could be that you want to pitch this to Dr. Hunsaker, and that's fine. But give us an idea of the percentage of a capacity. Has it ever been challenged at Grand Ron Hospital? It means give people some kind of an idea. Yeah. Sure.
Yeah. So, our average census, our inpatient census is about 12. And, but we, throughout the year, can typically handle about 25 patients in the hospital at any given time. And we do that several times a year. It doesn't matter. Sometimes it can happen in the summer, in the spring, sometimes in the winter. Certainly over the past couple months, we've had some days where we're at 18, 19. We've had some at 22 and 23. But we have great processes in place, a great case management team, and we bring a lot of stakeholders together to make sure that, again, that as our census does rise, that we have the resources, both from a personnel standpoint, but also from a personal protective equipment standpoint and other equipment to safely take care of patients right here at home. So the challenge at being a rural hospital, it's so hard to give an average number because, and Dr. Hunsaker might talk about this a little later, but we can have one day where we have 7 patients in the hospital, and the next day we're up to 18. And that variability we've experienced essentially for as long as we've been open as a hospital here locally. And it's something that we're comfortable with and we're used to adapting to.
So how has COVID affected that census? So, I mean, because we're talking about two different capacities, kind of.
Yeah.
The normal census capacity that the hospital has, and then the, the COVID crisis
Sure.
capacity that you guys have built into.
Sure. Well, in terms of the COVID capacity or census, again, it fluctuates. We can go days and weeks without any COVID patients in the hospital. And then we can have a period of time where we have one to three in the hospital. The highest that we've had at any given one time was 7. And so when you share those numbers against the backdrop and going back all the way back to March, again, we haven't had a lot of COVID patients admitted to the hospital. And we prepared. We've set up special locations in the hospital to keep those patients in a special spot. And our staff wear a special protective equipment, personal protective equipment, when they have to enter into those areas where COVID patients may be admitted and recovering.
Excellent. Now, we saw recently where you guys did a Facebook post of some of your employees getting the first vaccines in the area. Talk to us a little bit about that.
Sure.
And again, if you need to pitch this question to Dr. Hunsaker, then I certainly understand that.
Sure. I'll share a couple little things, and then I'm happy to hand the baton to Dr. Hunsaker. So yeah, we are, like you, we're very excited with the emergency use authorization for both the Pfizer and the Moderna vaccine. And we received our first initial allotment last week. And within less than 24 hours of receiving it, we had already operationalized a vaccine clinic here at the hospital that really focuses on frontline healthcare workers as well as emergency service workers as well here in Union County. And, again, the challenge, which I think everybody is aware, is there's just not enough vaccine yet to be able to immunize an entire population or an entire community. We don't even have enough to vaccinate our entire healthcare workforce here. So certainly we continue to work with the Oregon Health Authority and are optimistic that more will come. We actually got an additional allotment today. And so our team is starting to work through those logistics as well. But really, I think it's an exciting time. I was fortunate enough to be in the room when some of our first healthcare workers received the vaccine. And there was just a palpable energy and excitement that it's here. And we're starting to vaccinate frontline healthcare workers. So again, we can be even more prepared when you need us most.
So help folks understand, because the question is out there is, so when is the hospital going to vaccinate the public? And help people understand the line of authority of who gets vaccinated when. And does the hospital, I mean, you guys are just doing what you're being told to do. I mean, elaborate on that a little bit if you would.
Sure. Well, the main thing is we received an allocation to take care of Grand Ronde Hospital, frontline healthcare workers. And so we formed a committee, and I'll turn that, and I'll let Dr. Hunsaker speak to that. But we formed a multidisciplinary committee that included HR, physicians, nursing, really had a good broad cross section of folks and professionals that unfortunately we had to come up with a tiered approach. Who was prioritized, and really the guiding principle for that is those who are going to have prolonged exposure of taking care of COVID patients. So a lot of the folks like in our emergency room, in our intensive care unit, respiratory therapy, and so forth. But I think this is a good segue to let Dr. Hunsaker kind of talk a little bit more about that committee and that process.
So there's a couple of questions that I just need you to address real quick. So somebody to ask from Facebook, are you guys doing elective and non-emergent surgeries now? Because there was a period where you weren't. Is that kind of back to normal?
Yeah, that's a great question. So really the moratorium on elective procedures really only applied back to May, and I think it was April and May. And really since June, we've been back up to 100% of being able to, do elective cases in our operating room. And certainly we have to manage the logistics, and not all patients want to come in at the same time in terms of getting their surgeries. We've had a lot of folks who have postponed their surgeries because they kind of wanted to wait things out. But I'll tell you, our surgeons and our operating crew have been very busy over the last couple of months, as a lot of folks who had delayed those surgeries and who were in a lot of pain are now scheduling and wanting to get in and get that taken care of.
Good. And again, just to kind of put a button on what you said earlier, the allotment of vaccines that you have gotten, it's not for the public. That is specifically for,
right.
And you guys have decided how to distribute that among your folks, your frontline workers. And so the actual vaccination of the public, we'll kind of talk to Carrie here in a few minutes. That's really not your decision. That decision is being made somewhere else.
Correct.
Okay.
But certainly our committee certainly recognized that there are folks outside of our four walls of the hospital that are critical to the healthcare infrastructure of the community, and so some of those folks were added to the list, like EMS folks. And so, so certainly we've tried to move beyond just the four walls of our hospital, and as we receive more allotment, and as public health gets more guidance, certainly we look forward to partnering with them and using our resources and partnering with them as much as possible to help get the community vaccinated.
Good. And thank you guys for submitting your questions. And you know, some of those answers might actually be put in the Facebook comments themselves. There'll be links if someone refers to that, that information will be there. So let's bring in Dr. Hunsaker. I appreciate you taking the time to be with us tonight. And Dr. Hunsaker, tell us kind of what your role is at Grand Ronde Hospital concerning COVID. First of all, you know, you're a hospitalist, right? People might not know what that is. You might briefly explain what a hospitalist, and then kind of tell us about your role.
Okay, thank you. So I'm obviously a hospitalist here in La Grande. I have a partner, Dr. Blake Gornowitz, and he and I, between the two of us, cover every day here in the hospital. We work 1 week on, 1 week off. We take care of hospitalized adults. We don't do surgery, and we don't deliver babies. But people who have heart attacks, pneumonia, COVID, really any kind of medical problem will probably come to our service. So I trained in internal medicine after I finished medical school, and then specialized in taking care of hospitalized patients only. So I don't see anybody outside the office. And what I tell people is, if I walk in the room, you know something bad happened. So maybe you won't have to see me again when you leave, except maybe in the supermarket or so. So as Jeremy alluded to, we have had some COVID, but we have not had our worst fears realized. We have not been completely overwhelmed with waves and dozens of patients suffering from COVID at the same time. We really have been lucky, and I do think a lot of that is credit where it's due. The people have been taking this seriously. COVID-19 is a coronavirus. That's the family of viruses that causes the common head cold. Only this one happens to be, in some cases, devastating to people. So it is real, it is dangerous, and it does kill people. You don't want to get it. Symptoms with COVID-19 can vary from absolutely no symptoms whatsoever to death. And we're still trying to figure out, as a medical community, which people are going to be hit hardest and which people are going to remain asymptomatic. Those things down the line may help us to develop even better treatments and be able to initiate treatments sooner if we can figure out who's going to have a really rough course with COVID. But right now we still can't. And our treatment options are still quite limited. Really, the dexamethasone, or the steroid that we give people, is the one thing that has shown the most probable benefit in the studies that I've seen. and I know they have some other things on the horizon that maybe that famous people get, but they haven't come down to our hospital yet. There have been a lot of things that have had promise, and we have tried them, and when they're truly studied, most of them are equivocal at best. So really what we're doing in the hospital is supportive care. And to be quite honest with you, the single most effective treatment that I have for a patient with COVID is to prone them, get them to lay on their belly or as far over on their side as they possibly can in what we call the swimmer's position. That really does seem to improve their oxygen levels, but only while they're laying on their belly. So we're having some people proning for 16, 18 hours a day if we can get them to do it, but it's surprisingly uncomfortable and difficult. So with that being said, you can understand, and I'm sure share the same excitement that I have about the vaccine. When it came out.
Before you get there, let me just stick in a question. Give us an idea, what physically have you done? I mean, the hospital hasn't been open to the public for months and months and months. Have you guys made a special section in the hospital? What have you done to create a COVID unit physically? Just touch on that briefly, if you would.
I've been really impressed with our people here. Environmental services and our nursing administrators came up with a really good idea, because we found early on, as Jeremy alluded to earlier, that we could go from 0 COVID patients in the hospital to 7 COVID patients in the hospital literally overnight. And it's difficult when you still have everybody coming in with all of the other illnesses that don't change: congestive heart failure, bacterial pneumonia. All these things are still happening to folks. So we have to be able to keep them safe and isolated away from the patients who have COVID. But we can't block off 2/3 of our hospital and call that the COVID unit, because then we won't have capacity to take care of everybody else. So what we've done is we've found a way to actually put up temporary walls and aggressive ventilator systems, and we can put them up in less than a half an hour to erect a temporary COVID unit in different parts of the hospital. When I just got off service Monday night. When I left, we had 3 folks in with COVID in the ICU, and we had put up a temporary barrier through half of the ICU. So that half of the ICU was our COVID unit while we had that many people. And if another patient with COVID had come in, we could just extend that temporary wall out to the 4th room or the 5th room. And we did the same thing on the medical ward. So we were able to find places within the hospital itself that had adequate access where you could safely put on and take off your protective equipment, where you could disinfect yourself so that nurses were not carrying it in and out, and so that they could be safe when they were getting ready to go in and come out, because the studies have shown that that's where most of the healthcare workers ended up acquiring COVID, if they did, it was while they were putting on or taking off their protective equipment. So I was really proud of them for that.
So talk to us about vaccines. That's where you were going before I interrupted you, I think.
Yeah. So we're really excited to see the vaccine coming. So far, we have only several months of data. All of this is new. And anything I tell you today may be different 6 months from now, a year from now. But so far, both the Pfizer and the Moderna vaccines seem to be spectacularly safe and very effective. After the first dose of your vaccine, about 2 weeks after you get that first dose, right now, the last numbers I saw said that there was about a 50.4% chance that you were immune from COVID. About 2 to 3 weeks after the second dose of COVID vaccine, there's a 94.5% chance that you are going to be safe if you're exposed to COVID. I would like to say vaccines are very safe. This vaccine is a messenger mRNA vaccine. And what that means is they just basically inject little packets of messenger RNA. And you could think of those as blueprints or a set of plans that specific tiny little factories within the cells called the endoplasmic reticulum actually manufacture a protein based on that set of plans that we introduce with the vaccine. And then those proteins, once they're manufactured, they float around the body and they're found by cells of the immune system. Think of them as the police department. And the protein is foreign because the plans that were used to make the protein are foreign. And the policing cells find them, destroy them, and then generate armies of other cells specifically designed to recognize and destroy that protein. So if you are infected with COVID later down the line, you already have a full police force floating around in your body that will attack and kill the COVID virus before it can do all the damage that it does. And COVID itself doesn't kill you. COVID in some people causes their own immune system to go haywire, and we call it a cytokine storm. And that's what does all the damage in the body, and that's what kills people. So I can tell you with certainty, you cannot catch COVID from getting the vaccine. And after you get 2 doses, you're almost 95% likely to be safe if you do get exposed to COVID in the future. So I'm on the, I'm sorry, go ahead.
So, yeah, so just quickly, so while you're there, so personally, how do you feel about the vaccine? Or would you have your family, are you having your family take it? I mean, do you feel confident enough about it that you are investing in it personally with your own family?
I got it yesterday.
Yeah, when
I
that
told
comes
both,
available for others, yeah.
I told both my parents, and I didn't even need to tell them. They're calling their doctors saying, when can I get it?
Okay.
This will save your life.
Good, excellent, thank you. So go ahead. Go on.
So we discovered that we were going to receive a certain amount of COVID vaccine specifically for vaccinating frontline workers here in the hospital. And we formed a committee, as Jeremy kind of briefly mentioned. We had the infection control people here, pharmacy department was there, myself, several other MDs, nurses, and an administrator. And it became rapidly apparent to all of us just in the first meeting that really prioritizing people, because we knew we were going to get a limited supply and not be able to do all of the frontline workers at once, that any list we came up with could be passionately and reasonably argued. 300, 400 people need it, and they need it yesterday, and we're getting 200 doses. Okay, that's reality. So we have to find a way to kind of put people into different categories and rank them, if you will. So what we decided to do was just go ahead and use the same recommendations that we're getting out of the CDC and from the state, because they make sense. And we really focused in on those who have the most prolonged contact with patients who have COVID or patients who potentially have COVID. And then as soon as we get more vaccine, we'll go on to the next level and on to the next level.
So is part of that, one of the questions that came from Facebook is GRH considering vaccinating frontline workers that are not Grand Ronde Hospital employees?
Not with the lots that we're getting. These lots are specifically for us, but I think Carrie could probably tell you a little more about that than I can.
Okay, all righty. Well, let's bring Carrie in. And Carrie and I have spent a lot of time talking about stuff. And Dr. Hunsaker, we could spend an hour, I can tell you, talking about the disease and the treatment. And I could see this little cartoon in my head as you were describing policemen and so on and so forth with the vaccine. Thank you for that explanation. And if we have the opportunity, I would love to have another conversation with you, because I think that you offer some information that people just don't have access to. We hear a lot of information from everywhere else, but for local Eastern Oregon people, as you know, the voices in Eastern Oregon matter. And, so thank you for that explanation. And I would really love to spend more time talking about this. So, well, Carrie,
Happy to.
yeah, here we are again, and you and I were supposed to have a meeting today, but that was delayed because of this, and appreciate you taking the time. And so, first of all, I guess the big question is always in everybody's mind, when is the public going to get the vaccine? When are they going to have access to it? And maybe kind of speak about the thing that I started with before, and that is that where is the decision process made? The hospital, because certainly the hospital is the most visible of frontline workers that are getting that vaccine. And there is some perception of like, hey, when are we going to get it? And that decision is being made way upstream of any of us. And so let's start there. Talk a little bit about that, if you would.
Sure, I'd be happy to do that. First off, I really want to thank Grand Run Hospital for putting this together and for allowing me to join today. I think it's really great to hear directly from the hospital about what's going on there. And I really appreciate hearing that description of how this vaccine works. I've heard it described in about 3 different ways, and I feel like each time it helps me develop a better understanding of it, because we are using something that's a little bit new in terms of vaccine. And I feel like as we gather more information in ways that we can understand, I think it will make it, more comfortable for the public as we get closer to their turn to get vaccinated, so to speak. So, unfortunately, like has been mentioned so far, the supplies at this point are limited. And when we have a limited supply, we have to come up with some ways to prioritize that. And so there's a vaccine advisory committee at the federal level that looks at how we prioritize vaccine. That gets filtered down to the Oregon Health Authority, who definitely has some discretion on how it's prioritized at the state. But really, at this point in time, we have a vaccine plan that the Oregon Health Authority has developed that is being passed down to us, and that we are really just at this point operationalizing. So as the hospital gets their allocation of vaccine, and as public health gets their allocation of vaccine, we're basically going to go down that list and really follow those priorities and guidelines that have been given to us. And I think, I personally have no doubt that prioritizing the hospital is the right place. We need our hospital to have the capacity to treat people that have COVID-19. And I have to say, I was so relieved to see our healthcare workers getting that vaccine. It was one of the best days that I've had this whole year, knowing that they were protected and knowing that they were going to be there for me and my family if we needed them. And I'm also really grateful to hear that our community is eager to receive the vaccine and that they want to know when it's their turn. I think it's just going to take some time. There's a lot of factors that come into play. It depends on how much vaccine the state gets. It depends on how much vaccine we get here locally. It depends on how many people opt to take the vaccine. But what I can tell you is that we will definitely, as we get our allocations, we will be working through that list. I've seen questions that have come through about, how other frontline healthcare workers in the community will get vaccinated. So when we look at the vaccine plan, the group, we're in phase 1A, and there are 4 groups in that phase 1A as of today, and that could change, and I'll talk a little bit more about that later. In the first group, it's the hospital. So obviously they've received vaccine and they're starting. That first group also contains EMS and first responders, which includes fire and police, or law enforcement, I should say. And so, as the hospital has shared, they're really primarily focusing on vaccinating their own employees. So when public health gets our allocation, we will then prioritize the groups that were not hospital employees or members of those groups. And then, group 2, we move into other categories like, and I'm actually not going to say them all because there's a lot of different groups in those categories, but we have been over the last month or more really working to identify the entities in our community that fall in those groups, and we'll be sending out communication to them ASAP to get them on a list. So when we have our allocation and we're ready to give vaccine, that we work through that list of priorities. So and then beyond that, we get into Group 1B, which is essential workers. And the reality is the Oregon Health Authority has a vaccine advisory board that will meet in January. That's probably really going to put the details into that part of the plan. And so it's just going to take some time for us to get more details about what Group 1B looks like. And then after that, hopefully we'll get to anybody that hadn't fit into one of the previous groups.
Good. And just a brief note, I'm getting text messages from folks that are sending me texts and questions, and if you want those questions to be be answered, I can't get to my phone right now. Be sure and use the means that I've communicated. So, Carrie, I got an email yesterday that apparently Safeway is going to be distributing the vaccine. Yeah, who knows? So, and I guess that it's going to be free. Again, talk about when it does come to the public. Do you have any hunches on where it will be distributed other than Safeway, which is what, or, kind of give us an idea of how you think that might be rolled out if you have an idea.
I think that we're still figuring a lot of this out. I think that it's pretty clear that these first phase 1A groups, they will either be going directly to the healthcare provider themselves if they are signed up as a provider. They will be done by the pharmacy program that the federal government has set up. So we have long-term care facilities, skilled nursing facilities, congregate care settings where people live are also very high on the priority list. Those are going to be done almost entirely through a federal program that's partnering with commercial pharmacies, and then through public health. I think it's very plausible that when we get to the public phase of this vaccine and we're really able to open it up to everybody, I think it's very plausible that it will be exactly like you get other vaccines, and you can get the vaccine at your healthcare provider, you can get the vaccine at a pharmacy, you can get the vaccine at public health, and I imagine that it will become, as it becomes available to anybody, that it will become more routine. But I feel like I don't have the ability to completely predict what that will look like. But what I do want to share and what I want to make sure people know is that I mean, we have so many people reaching out to us saying, like, when can I get the vaccine? How will you know to contact me when it's my turn so I can get it? And I really want to reassure everybody that we'll make sure that we're sharing the information very widely. And so right now we really are contacting those entities directly because we know, like, law enforcement, okay, we're going to contact law enforcement directly. There's going to be some other groups. In the phase 1A, we have, dentists, for example. When we will contact them, we will make sure they're on our list. So we're not able to just open it up to everybody. But when we get there, we will post it on our Facebook. We'll put it on our website. I will come talk to you about it, hopefully. And we'll put, really, really try and get the word out very, very widely, and think about other means as well for folks that aren't plugged into these spaces. So we make sure people know that it's available and they know that they can come get it. And so I also hope that we'll continue to have some educational opportunities, like you just said, like really making sure that we create space for people to get their questions answered, really specific to the vaccine, so they can make an informed decision.
Good. So you've got to be, your whole life, hours and hours for the last 9 months, 10 months has been absorbed by this. You've got to be thrilled that there is some good news on the horizon in the way of a vaccine. Personally, how does that affect you?
Yeah, like I said, I shed a few tears when I saw those first healthcare workers getting vaccinated, and I still get emotional about it because it really was this like sense of relief, like we have a solution in sight. It's been really hard to witness how this has impacted our communities on so many different levels. It's been really hard every time that we've reported somebody has lost their life. So I think, I have a huge sense of relief and gratitude that we've been able to move through to this phase so quickly, have extremely well-studied vaccines that are extremely effective. I mean, it's a gift, but I really also want to remind us that it will take time for the community to get vaccinated. It'll take time for us to get them out to everybody who wants them. And so we are going to still be in this for a little while. It's still going to take some time for us to get to that level of immunity in the community that will protect everybody, regardless of whether or not they've been vaccinated. So we're going to still need to engage in the precautionary measures that we've been talking about over and over again every time you and I have spoken. So, I think there's light at the end of the tunnel, but I think that it's also going to take some time for us to get there.
You and I have talked about this publicly before. You have children, they've been home, and kind of where we're pivoting to is George Mendoza and the LeGrand School District. Let's talk. Let's bring George in, and George, talk to us about kind of where. What do you anticipate? Are you excited? I don't know. Give us the big news.
Well, it's definitely big news. I guess it was even big news to me on December 23rd when I received a phone call from Colt Gill, and he said that on, basically in the afternoon, there was going to be a press release from the governor indicating that the metrics was no longer going to be a requirement, but it was going to be advisory. And so that section is now removed. So definitely there's going to be advisory capacity, but local decision, local context, and local control for us on what we can do to operate. We definitely will have to keep looking out for attendance rates, the level of COVID cases in our community, the level of cluster cases taking place in our buildings or throughout our district. And then we also need to look out for the operations side with the availability of substitutes or the availability of our workforce as well. So we're still not in this spot where it's just kind of do whatever you want, because we really can't do that. But we definitely can start to do more with in-person learning. So just to be clear, on December 19th, we had a town hall. I shared a lot of information. In that information, I already indicated that schools were given safe harbor, or at least Union County and districts that were less than 30,000 were given safe harbor by the state as an extension. Under that bucket, I was able to share that we were able to bring back K through 6. Originally, I don't want to go into great detail, but originally we were able to bring back K through 3 due to buildings being less than 250 in our school district. We're a much larger school districts than the school districts surrounding us. We were able to bring back K through 3 for quite some time, about 2 months, and then we had a lot of COVID cases in our community and COVID cases in our schools, so we had to go back to comprehensive distance learning. But what I shared in December 19th was that we were going to be able to bring back K through 6 on January 11th, and that's still the case. We're definitely bringing back our K through 6th grade students on site January 11th. Grades K through 5 will be stable cohort every day, and then grade 6 will be an A day, B day model. And there's a lot of logistics, and we do have a town hall and presentations and details in our website and our social media. But now I think the bigger question that I'm receiving on a daily basis is, what's the plan for high school, or what's the plan for 7th grade through 12th grade? And I indicated as well on December 19th that there was a strong potential for us to return our high school students and middle school students back on January 27th. That's still the case. We definitely plan on it. We're looking forward to it. I like to use the word may or likely because I don't really know the complete future of safety. I don't really know the complete future of all the many things that will happen. To be perfectly blunt, that December 23rd announcement came while schools were in our winter break. I haven't talked more than 10 minutes with Colt Gill. On January 4th, I'll be meeting with him and the governor and governor's liaison and other superintendents to discuss what exactly this change from required to advisory means. Throughout January and into January 19th, there'll be new updates to the metrics. There'll be new updates to county case rates and case counts. There'll be a lot of new information that potentially can have an impact as well. But the bottom line is if we're going to have our 7th grade through 12th grade back on January 27th, I'm definitely planning for that. But it takes a while to ramp up the food, the logistics, the transportation, the operations, the instructional needs that parents are going to have for the second semester. That is a time where parents will potentially transition from online back to in-person. And all of these things happen in a short amount of time. So we're definitely going to be working hard to organize ourselves and be ready for all students basically back by January 27th, but definitely K through 6 is back January 11th. And I'm going to just say it's 98% certainty for me that we'll have the grades 7th through 12th back by January 27th at the beginning of the second semester.
Awesome. So you know me, I'm asking hanging questions. That's kind of my thing. So as we know the statistics of COVID, we know that younger folks, children, teenagers, they have there are some cases where that has been serious, but for the most part, they are not part of the group that is the most vulnerable, but teachers might be. And so how are your educators responding to this? What are their thoughts? And maybe you haven't heard from them yet.
Oh no, I hear from I hear from our union quite a bit. I meet with them, our union executives, once a month, and then honestly, when it's time to go over things with our executive teams in our unions, I do that. And then I definitely have town hall, or I'll just call them all staff meetings as well with our district and hear input. And we do take surveys. We've taken 2 different surveys this year as well to talk about the intentions or the needs of our staff and the desires. And we're still at about 80% of our employees are they're ready to go. They're ready for in-person. They look forward to that. And then we do have employees. 20% of our employees are our workforce that's worried or concerned for their safety or for COVID. And we definitely give the max amount of accommodations and personal protective equipment and the support that we can give that's reasonable and prudent. And when we work with our employees based on their needs and provide them the support that we can offer that's legally required for us to do and that we want to do. So we're still in that spot. Our K through 6 tell me often how much they want to have their kids on site, and so do our middle school and high school staff. And so I'm going to just say that we've got a strong workforce, ready to serve, excited to serve, wanting to see their students every day. We all have a deep care for our children, more than I think folks realize at times. I myself have 2 children in our school district. I am a father. I am a parent. I greatly care about their social, emotional, their mental health, their physical well-being, in addition to the instructional side or the academic side. And there's a lot of staff members that feel that same way. We want our children in our schools. We want them in our school as often as we can get them. We got to follow a lot of rules and laws and guidance, and we want to do it safely. But we definitely want our children in our school because we believe that that's the best place for them to be. So that they can become the best adult that they can be.
I have this funny picture in my mind of a classroom full of students and a teacher up in front in a hazmat suit. Who knows where that's going to go? But so again, to our audience, there's a lot of good information that George Thompson from the CHD is putting in the comments and addressing many of the things that you're asking. So be sure and check that out. So talk to us about the vaccine. I would I mean, I haven't seen the list, but of who gets the vaccine when, but I would imagine that teachers, you know, if the goal of the governor and the goal of the state is to get education in person going again, that, you know, they're going to be a priority. Talk to us about the significance of what you think the vaccine is in order to making school happen.
Yeah, thanks for that. Well, I would even say I think Carrie talked a little bit about advocacy and then a council for the state that's trying to align essential workers and when essential workers can receive the vaccine. And I've asked Chris Wagner to apply to be a part of that council. When we can advocate with the state, LeGrand usually takes the position of trying to be involved in those meetings and see what we can do to influence outcomes that better serve our school district or our region. And so we're definitely asking to be a part of the council for essential workers and vaccines. Now, back to vaccine in general, my understanding is that we are phase 1B or phase 2, but phase 1B is what's described as essential workers. We have asked quite a bit to make sure that all of our teachers, all of our staff, all of our substitutes are included as part of that essential worker category. Of course, we need that so that we can operate safely and move forward. Definitely, you know, my goal or my hope is that we would get the vaccine as soon as possible, but my understanding is that we'll be lucky if we get it in late March or early April. For our staff members, what that means for us would be that if it's a 21-day or 28-day period between both shots, the reality is at best early May, we would have our staff vaccinated, those that wish to participate, and of course I recommend that they do. Or it would be at the end of May, where we would have our staff vaccinated. So that's not, I'll just say, the news I want to give or the best position that I want us to be in, but that's the reality. We will likely not have all of our staff vaccinated until what is considered the end of the school year. What's going to also happen is they're still developing a student vaccine or a child vaccine for children 0 to 16. And that's still out there and that's in development. And what I hear about that is that it'll likely be somewhere in June, July, or August where that gets finalized and approved. And then again, it's likely a 2-shot vaccination. And of course, if that's not through and into LeGrand or into Union County until July or August, that's a 2-shot thing, where again, it won't happen until September or October, where folks get their 2 shots. And then, the reality is sometimes I'm hearing that it won't even be approved until August or September. And so then that makes it so we might not have it completely in Union County until November or December. So I guess what I'm getting at is that we'll be very, very lucky if we have what is considered herd immunity or community immunity with the vaccine. But I do believe that by the 21 or by the end of the 21 school year, 21 year 21, by November, December, we should have our employees, we should have our students, we should have our community vaccinated to the point where it's 70% or 80% so that we can just move forward. I don't know, I'm not ahead of everybody with guidance or rules or laws that are going to be made, but I do believe that if folks want us to operate or have full operations, we have to reach that herd immunity capacity for us to bring back all of our services essentially as it was before pre-COVID. So I definitely recommend to participate in the vaccine process once it's available. I'm not a doctor. I'm not an immunity doctor as well, or an epidemiologist. So I think folks need to talk to their doctors. They need to talk to, get information from Dr. Fauci or CDC or World Health Organization or people that they believe are reputable and experts at vaccinations and immunities. But I do believe that in order for us to be what we need to be, best serve our students, we do need to have full cooperation with the vaccination process.
So, quick question before we move on. So then, essentially, the state is giving more control to the local school district to be able for them to move forward. Okay, but a part of that is a plan that you guys are developing and have developed. You and I talked about this before, and that is so then. I mean, you're doing classrooms in cohorts, which is groups of kids that stay together, so that if some reason there's an outbreak among that cohort, then it can be controlled or it can be isolated or whatever the case might be. And so one of the questions that had come through is, so is there still an option? And I think I know the answer to this question, but the plan is if the beginning of the year they signed up for the in-school learning possibility, then when school opens, they need to go. Yeah. And so there's not some option to where, yeah, I don't feel comfortable, and can you set up a camera and let my kids zoom in?
Yeah.
That,
Well, at this point, I'll just say it's not a strong option. We definitely provide some level of accommodation or modifications where we can. Specifically, if a child does have an IEP or a 504, we're always looking to see what we can do to give any accommodation necessary, such as providing a camera, such as having them view sessions taking place. But in general, it's very hard for our teachers to focus on 20 to 24 or 25 students that are on site, in addition to focusing on students that may be viewing in. We moved to an A-Day, B-Day model for grades 6 through 12, and it was really due to the reality or the experience of having COVID cases take place in our schools, and then having COVID cases with folks being part of close contacts. And once we had, an outbreak, or once we have situations where folks have COVID or folks are part of close contacts, we significantly have to shut down operations because we no longer have the staff to be in the building. And then we really struggle with that. So the A-Day, B-Day makes it so that it's a lot harder to have close contacts, because the state made a rule also somewhere in late October where a close contact was defined as any person, even if they have a mask or they don't have a mask, that's within 6 feet for more than 15 minutes. And of course, when you have 25 high school kids or 25 middle school kids plus a teacher or a parapro in a classroom together for more than 15 minutes, the reality is a lot of them are closer than 6 feet to each other. So it was putting our school district in a spot where once folks from CHD or once our nurses wound up investigating and looking into situations, we were significantly having a lot of close contact with those high student ratios in our building. So we really needed to get to an A-Day, B-Day for middle school and high school so that we could keep operating and we can consistently move forward with our cohorts and with our operations. But in our elementary school, where we have a little bit more space in our classrooms and we have smaller students and we can do a better job with cohorting, and they don't travel from one class to another class to another class or another class, it makes it easy for us to keep moving forward. And I just want to make it clear too, with in our school district, we've had around 217 cases of having staff be a part of COVID or having primary symptoms of COVID or being a part of close contact. Staff and students. So we are significantly impacted in how we run and operate with the health data that we collect. And us moving forward is a big step, of course, in looking out for the safety of our students and their learning. But it's also important that we look out for the safety of our employees and our staff. So there's a lot of factors that weigh into us bringing students back. But I want to make it very clear, we are excited to have our K through 5 students back every day, our 6th grade through 12th grade back soon. 6th grade will come back at the same time as K through 5, A-Day, B-Day. 7th grade, 12th grade will come back January 27th, A-Day, B-Day, on site. You're right, parents will have to figure out, even those that have been online and full online, if their intention is to try to return in the second semester, we need to know that. If they've been in what we call CDL, comprehensive distance learning hybrid, and they're coming back. We need them to get ready to come back. And if for some reason they're going to say, well, we just don't want to come back yet, county metrics still says that you're at extreme risk and you guys shouldn't be doing anything right now. Because I get both sides. I get parents that say, let's go. And I get parents that say, what are you doing? And I do hear folks saying, the extreme risk is a liability. It's not something you guys should be moving forward with. And of course, my position is we're going to start moving forward with getting kids on site as often as we can. And 7th grade through 12th grade will be January 27th. And we do need to get the instructional intentions of families updated, as well as the transportation intentions and logistics updated.
Thank you for doing that. And again, just to put a button on that specifically, you guys are managing risk. That's what you're doing. And it snowed. I mean, anybody who looks outside, there's snow on the ground. And when I get done here, I'm going to get in my car and I'm going to drive home. And I'm taking a risk on how fast I'm driving and all of that stuff. So we operate our lives managing risk. And this, just one more time, I know the answer to this. You guys have figured out this plan a long time ago. It's not, It's not like all of a sudden it's like, oh hey, this is going to happen. Oh crap, we got to figure out what we're going to do. You guys have planned this for a long time.
Yeah, and I would say if folks really want to get into a lot of information, we have a COVID response plan webpage. We've got a lot of social media links as well. And we link our resources to our webpage. We have a reopening plan handbook. That handbook explains the beginning, middle, and end of all the operations, the safety, the instructional approaches, how we're looking to deal with COVID, our position, our stance on a variety of things as it relates to COVID. I would encourage folks to visit our webpage, especially our COVID response plan website. Look at our resources, look at our safety tips. Look at I'll just say, look at our plans. We definitely have a lot of things organized for how we plan to do comprehensive distance learning, how we plan to do in-person learning, the offerings that we have, the situations that we do for key practices and for dealing with COVID cases and COVID scenarios. We've got a lot of resources and we follow those resources. And the state required us to have blueprints. The state required us through Ready School Safe Learners to have a lot of operational guidelines. We have that as well. And we show that information so that if folks really do want to look at what's going on in our school district and how we're figuring things out, I would really encourage them to go to that website or check out our Facebook, social media. We've got about, and I think this is 5 or 6 town halls that we've participated in. We record them. We have them for folks to look at. We have a reopening website for questions and answers, and folks can submit questions to our school district webpage as well. And folks can communicate and ask us anything they need to ask us, and as well as talk to our principals. But we have a lot of blueprints and guidelines and rules and things that we follow. And we do have a variety of instructional plans for any given situation that we're presented with.
Good, thank you. So I'm gonna bring Jeremy back in, and we're gonna go to a question and answer session. So I'm gonna take you out for just a minute, George, and I'll bring you back here in a second. But Jeremy, just one question that I want you to answer is, so there's sometimes the hospital gets heat because why don't you tell us how many COVID patients you have right now? Right. Speak for just a minute before we go to the general question and answer session about patient privacy, how you guys have to protect that, how it's affected in a small community. Can you address that for us?
Yeah, it's such a delicate balance, and you kind of hit the nail on the head there. We really, as an organization, as a hospital, take privacy. It's very important to us, and unfortunately, in a small town, the moment you say you have one in your hospital, it doesn't take long for somebody to figure out who that one is, and so, as we've talked to other hospitals across the country, again, you're going to find some that shared a lot of data very early on, and others that didn't. and some were small, some were big, and everything in between. And so we really just took the stance early on that we were going to do everything we could to protect patient privacy. Again, there was a lot of unknown early on. We recognize that there might be some stigma tied to whether you've had COVID or not. Certainly, I think that is being relaxed to the point now where we're being a little bit more open and transparent and sharing some of our numbers. And because hopefully sharing that we've had over 40 that have been admitted to our hospital shows that not only have we been entrusted with taking care of very sick patients, but yet we also haven't been overrun. And we've been able to continue to maintain critical healthcare services, continue to do elective procedures. Our emergency room is open. We've opened up a new urgent care during this pandemic. We continue to make investments in this community to improve access and improve quality and improve the life of folks in Eastern Oregon.
Thank you. And so let's talk about that. I'm going to bring everybody in, Carrie, but let's talk about that specific question. And that is, I read the stats today. We're like at 900 and something. I mean, we're going to be over 1,000 cases not too long from now. But again, in comparison to 1,000 cases in the area, and I know there's a lot of mishmash in that numbers, and people kind of get hung up in numbers and so on and so forth. But when you consider, I don't know, what'd you say, Jeremy? A total of 40 cases?
We've had just over 40.
Yeah. So we're pretty fortunate. Now, it doesn't mean that we should relax, but
right.
Given, again, even, George mentioned that I think that there were a couple hundred cases that just the school district has had, and so on and so forth. I mean, we're pretty fortunate.
Yeah.
I don't know. Do you have a comment on that?
Just to clarify, it's not 200 cases that the district has had or students have had, but it's impact where we've had to lose instructional time with students or staff where they could no longer be in our buildings. But we've had 217 either students or staff that had to be quarantined or isolated.
Got it. Okay.
Due to COVID.
Thank you, and thanks for that explanation and clarification. So, I don't know, Carrie, maybe speak about that a little bit. Our overall case, I don't know, do you want to comment on that?
Yeah, I can comment on it. I think, we have been really fortunate when we hear our hospital tell us that they have been able to handle what has come to them. And that is what we have been trying to accomplish all along as we move through this pandemic. And I am reassured every time they communicate that they have had patients with COVID-19 and they've been able to manage what has come their way. And that's, again, what we have hoped for. I think I'm feeling hopeful that the cases are seemingly downtrending right now, but I also don't want us to lose sight of the fact that even though it doesn't seem like it's been extremely overwhelming in our community, that we have had people that have lost their lives, and that is also what we're trying to prevent, in addition to trying to keep our hospital able to care for people that present there. So I think it's I'm grateful to see the direction that we're going right now, and I think, as I said earlier, we really do have to stay the course for a little bit longer. And I know people are tired, and I know it's honestly hard. I really want things to get back to normal just like everybody else does, but I think we are going to have to continue taking action because there are still people that are getting severely ill, and we do want to prevent those serious outcomes.
Good. So, Dr. Hunsaker, a question, and just kind of a curious question. So everybody's wearing masks. Is the flu season, are we having less flu this year than what we've had in the past? And again, you might not have an exact number. Do you have a hunch that all of this stuff is helping decrease the flu activity?
It's really difficult to say with the flu. The timing of the outbreaks is variable, and it can happen and peak really anywhere in the kind of winter and even sometimes into the spring months. So my gut feeling so far is that, yes, we're seeing less influenza than in previous years. But like I said, it might just be coming late this year. And I would like to say, if I could, with regards to wearing masks, I was talking to my own mother earlier today, and I was harping on her to wear her mask. And she told me, that's all just a bunch of baloney. It doesn't work. We all know it. Unless you're wearing an N95 mask, the virus is just too small and just passes right through the mask. And my response to her was, that's technically correct, but the vast majority of the virus that you exhale is attached to small droplets of moisture. And the droplets of moisture are caught by the mask. And of course, it won't catch every virus particle that you could exhale. But if I can decrease the number of particles in a room by 70, 80, 90%, then it just makes common sense that fewer people in that room are going to come down with COVID. So wear your masks. They are not perfect, but it does work. And remember, my mask protects you and your mask protects me.
Good. Thank you for that reminder. So here's a question. I mean, the vaccine is coming. It's here in some cases. You are in Eastern Oregon. You know Eastern Oregon folks. Some of them are just obstinate. I mean, you can say that car is blue, and they'd say, well, it is in the rest of the country, but in Eastern Oregon, it's this color. It's just kind of how we are. Jeremy grew up in Baker City. He knows this too. So
I actually grew up in Baker as well.
Okay, all right, yeah. So
he and I are in cahoots on this, and both of us have been accused of being obstinate ourselves.
Yeah. So give me your best pitch to Eastern Oregon folks, starting with you, Jeremy. The way you are on the screen, Jeremy, Carrie, Dr. Hunsaker, and George. Give me your best pitch on why this is a good thing. Doing a vaccine is the good thing.
I'll tell you, I've got 2 points to share. One, I can tell you just within our own workforce, I don't have the exact percentage, but if you would have asked me, 3-4 weeks ago, I would have put us at a much lower percentage of folks who would be interested in taking the vaccine. And that percentage is much higher. Even myself, if you would have asked me, 6-8 weeks ago, I was kind of on the fence. But now that I've been able to do more research and look at the science and talk with folks that I really trust, kind of getting away from the typical outlets that you might watch or read, but really talk to pharmacists and physicians and researchers who really understand the logistics and what it takes to bring something to market, whether it's a medication or a vaccine. Again, it just makes a lot of sense to do the right thing and to get the vaccine. But as somebody said earlier on, again, talk with your healthcare professional, talk to your physician, talk to talk to those that you trust, and make that informed decision by yourself. But I can tell you, for me and myself, once I'm added to the list of getting the vaccine, I'm going to take it.
All right, and then speak to your family. I mean, each of you as you go through this. So, Jeremy, do you want your kids to take it? I mean, when that's available, your family, your parents. I mean,
I do. I believe in the science, and many of the folks who have already received it here in the hospital, I have an immense amount of respect and trust in, and knowing that they took it, I have full faith and confidence in the science and in the plan.
Excellent. Thank you. Carrie, so give me your best pitch.
Yeah, I think that I don't ever feel like it's my, that I'm going to convince people of my, to think the same way that I do or believe the same way that I do. I really feel like it is people's prerogative to gather information, educate themselves on the vaccine, and make a decision that works best for them. So I'm really looking forward to, in the next few months, having opportunities for our community to learn more about this vaccine. Because if I'm being honest, like, if you would have asked me a month ago whether or not I was going to take the vaccine, I was like solidly in the maybe column. And it wasn't because I have a problem with vaccines. I get my flu shot every year. My kids are completely up to date on all their vaccines. But it was because I still needed more information. And as I've continued to learn about this vaccine, I feel like that hesitation has definitely left. I'm definitely, I have, like anybody, normal concerns about side effects because I don't know how it's going to affect me. Am I going to have really serious like chills or fever, or is my arm going to be terrible? Like, I won't know until I get the vaccine. So, I mean, I think that there's always, it's human to have questions and be concerned and, maybe even have a little bit of anxiety about doing something like this. But I really do believe that having a immunity through the vaccine versus having the full-blown disease is definitely the best option for me. I think the other thing that has been reassuring to me is I've learned a lot about how vaccines are approved, how we do this work in our country. It's a completely public process. I watched the FDA hearings on my Facebook or YouTube. I mean, it was a very transparent process. This vaccine has been, and I'm not a physician, so I don't know all the science behind the studies, but I do know that it's been tested more than any vaccine that we've ever had. And so, again, I feel like we are going into this with a really, really good product that's going to protect a lot of people. And so, I think for my kids, there are a few pieces of information that I want to know. It'll be the same thing. Like, do my kids have health conditions that might preclude them from doing it? Would their doctor recommend it? Absolutely. And when I see people on this video that are saying they've taken it, I know other people in the community, healthcare providers that I trust that are taking care of me and my family. I think it gives me reassurance that this is safe and effective and that it's the right choice for me.
Excellent. And if there's anything you can say about Eastern Oregon people, is they're not sheep. They're not just going to get in the line and do the same thing. So Dr. Steve, give us your best pitch on, and I really appreciate you sharing, talking about your mom, because that's real life for us here. And if there's anything that we know that, the people that are watching, they want a real conversation. They don't want something glassed over. They want to know that, as leaders, you guys are facing the same things that the rest of us are facing. So give me your best pitch.
So I would say believe in the science, but also just believe in history. If you're worried about how effective a vaccine could be versus taking the risk of getting COVID-19 and hoping that you survive and don't have long-term consequences, just go back and do a little reading about facts in history, and find out what it was like to live in a world where polio could not be treated, where measles and mumps could not be treated, where tetanus could not be treated. See how people lived with that, see how they died with that, and see how some people who didn't die with it were the unlucky ones because their bodies or their minds were absolutely devastated by something that we can now treat with a safe, effective vaccine.
Excellent. Thank you. So George, you probably are more nuts and bolts than the whole rest of us, because you have, I don't know, how many kids are there in the school district?
Well, on our pre-COVID, we were at 2,350.
Okay, yeah. So you have this workforce, this students. I don't know. Give me your best pitch.
I would tell you on that note that kids need COVID relief. We've been doing a lot of COVID relief for adults and workforce, and a lot of people that are, I'll just say, in vulnerable populations, and that's great. We need to love, protect, serve, take care of everybody, but we really need to do a great job for our students in this time, our children in this time. They need COVID relief for their academic needs. They need COVID relief for their mental health needs. They need COVID relief for their physical health needs. We need to do things that get things to operate for them. And if taking the vaccine helps move us in that direction, then I'm all for it. I definitely care about side effects and adverse effects and making sure that we do the right things with what we put inside of our bodies. But I also trust our doctors and medical professionals and healthcare providers and Dr. Fauci and CDC. And I know that there are lots of systems in place that make things work. And when things aren't working, we have lots of systems in place that stop things that cause us harm. And so I trust that process and I trust those systems, and I ask that people do those same things. But the biggest thing I would say is if folks want us to get back to normal and want us to fully operate back to normal, then the vaccine is a part of that pathway for us to get back to normal. And the more that we fight it, or the more that we do our own thing, the longer this will take, and the more our children or other people will struggle and suffer during this process. So I'm in. I definitely hope our staff is in. I can't, I recommend to them those things. It's not a requirement, of course. And I'm definitely in full support of my family participating and taking the vaccine.
Good. And I have to say that, before this conversation, I was kind of a maybe, and I'm still a little bit of a maybe. I'm from Eastern Oregon, so, or I grew up in Wyoming, which is not far from Eastern Oregon. So, so I appreciate what you guys are saying. I appreciate that, and I appreciate the real live examples and experiences, so on and so forth. So, well, anybody else? We're getting ready to go. Anybody else want to comment on something that a question another person answered that you think you might be able to add to? Anything short you want to throw in here before we go?
I do want to say two things really quick.
Okay.
I just, I was kind of peeking over at some of the comments on Facebook, which I don't normally do during these lives, but I think that there's a really important point when we're talking about vaccine. The reason why vaccines work is because we get enough protection in our entire community to keep the whole community safe. And what that means is that we know there are some people in our community that cannot get vaccinated for a number of reasons. Like, it's just literally not an option for them. And so for those of us that can take the vaccine, that don't have those really concrete and valid reasons for not getting it, we protect everybody else. And I think, you and I have talked so much through this pandemic about how our actions impact other people. And I feel like this is a way that we can take action to protect our community and really keep the members of our community safe that won't have the option of the vaccine. So I just encourage people to think about that when they're making their decision as well. And I didn't get a chance to say this, I alluded to it, but never got to it, but I do think that we might get some updated guidance on the priority groups, and that teachers, and I haven't seen it come out yet, but I think there's a chance that teachers might be put a little bit higher on the priority, knowing how much we value education in our state and want to have our students back in school and have our teachers and staff at schools able to serve them. So I think we'll get more information about that in the next few weeks along with the vaccine priority. So I think more to come on that. Keep an eye out.
Excellent.
One thing I would share, excellent points, Carrie. One thing I would share for us is it's one thing to get open, and then it's another thing to stay open. So if we're going to stay open and really be able to serve students long-term in person, we've got to be vigilant about following all those key practices and key guidelines that we get from the state or we get from CDC. So if folks are sick and children are sick, they need to stay home. We need to wear our face masks. We need to clean, sanitize, wash our hands, clean high-touch surface areas, do everything we can to keep our hands clean. We do need to practice social distance, more than 6 feet at all times, as best we can, or do things outdoors, but stay away from each other for at least 6 feet, and don't violate that 15-minute rule. That 6 feet, 15-minute rule really harms our school district from operating. So folks really need to understand that. And if we can limit social gatherings, or can limit the opportunities for us to be with each other and then create those close contacts or spread COVID, that's another thing that'll keep our schools operating. So it's just very important that it's one thing to get open and say, let's go, but it's another thing for us to stay open. And to stay open, we just gotta stay safe, mask up, and socially distance.
You are totally a teacher, George. And Garrett, man. Yeah. So, uh, and I would say, Carrie and I have talked about this before, and that is, I mean, small businesses are just, restaurants are just, I mean, they are hurting so much. And what we do as a community, I mean, so often we think about, well, you know, it's only affecting me, but what we forget, and you made that point, George, is that what we do as a community to stop the disease affects businesses, it affects schools. And so even if you don't disagree, even if you don't agree, you think it's just a bunch of baloney, you still are, your contribution to what you're making in following the guidelines is helping, schools stay open, helping businesses open up, helping businesses stay open. So excellent. Anyone else?
I just noticed one question on Facebook, if I could.
Yeah.
The question asks, how can we protect immune-compromised people from shedding this vaccine? And I'd just like to reiterate, they can't shed anything after they get the vaccine. Remember, the vaccine is a set of plans that your body uses to make a protein, and that same protein is located on a COVID-19 virus. And so when you build your police force to directly detect that protein, anytime COVID-19 that has that protein on it enters your body, you have that police force already there and they attack and kill it. So giving someone the vaccine is absolutely nothing like giving them COVID.
Excellent. So, and I know you're really busy, but you could totally be on the city council.
We'd like to keep them here.
I appreciate that. Thank you. So,
Yeah,
all right.
they keep me pretty busy.
I know they do. Okay, well, so Jeremy, the hospital did this. You guys are the ones that put this on. I give you the opportunity to give us a last word.
Sure.
I appreciate you guys doing this.
No, again, I just thank the community for taking time to listen. Again, as I shared early on, we've had a lot of phone calls with Carrie and with George and with other Union County officials. And, it really is a fabric that has us intertwined. And it's been tough. It's been challenging. There's been no exact right answer for what to do. But collectively, we've got some great folks here in Union County that have banded together and have worked hard to ensure access to care, ensure access to education, and do it as safe and effectively as possible. And certainly with the pronouncement of the vaccine, there is a high sense of optimism. But as we shared throughout the presentation today, we can't let our guard down. And we appreciate your help as you do the right things in terms of masking and physically distancing as we continue to try to protect hospital capacity. So we thank you for your time, and we hope you have a wonderful evening and a wonderful new year.
All right. And again, thank you, each one of you. I know each one of you personally. Well, I just met Dr. Steve today, but I know you guys care passionately for what you do. And you don't have some hidden agenda. You're not benefiting. You're not getting a take on the financial things of the vaccine. I mean, there's no backdoor deal that's going on here. This is just you guys caring about this community. I know you invest in it, and I really appreciate you guys taking the time. And again, Eastern Oregon, thank you for tuning in, and we will see you next time right here on EO Live.